That's Travis from KDT, and what we're going to go through today is the KDT cervical setup video. So basically what you want to do in the beginning is you want to elevate your thoracic section here up about 15 degrees so it's comfortable for the patient to have the knees bent. The tail section here should be level as a good baseline. You'll see here your level should be on the side of the table. You're going to pull up your full Swiss leg elevation system a little bit here. When you come in, you're going to grab your cervical. It's going to slide into the RB pillow, and you're going to lie it on the table just like that. And it's important that the edge of your cervical unit is between the edge of the face hole and the edge of the cushion. So it's going to set on there just like that in the middle of the table. Then we're going to elevate this back cushion up about 4 inches or so. And then we're going to have our patient come in here and get on the table. If they're a female, they're going to part their hair and put it to one side. They're going to lay back into the cervical unit. And there's a little gray insert that we'll show you later that has in there for additional comfort, or if they have a skinny neck, you can take up some of that space. But you want to start down on the base of the neck, so on top of the traps. You come in with your index finger and your thumb, and you're going to tighten up the occipital rubber grabbers like that to patient comfort. Your cervical forehead strap is underneath the table cushion here. It will be slid down here, put right over above the eyebrows, and you're going to simultaneously pull down so that tightens up. And you're going to snug it up and make sure it's good and tight on there. You don't want to over tighten it, but you want to make sure that it's good and snug. If it's loose, it will slip off the forehead. As far as the table elevation, you're going to elevate the table height until the rope clears the unit. Right around here is a good height, so the clip here is above the unit, and the rope is about 1/4 of an inch or a finger's width above the top of the traction head. Ensure the patient is comfortable here with the knees. You always want to have the knees bent in cervical traction to take off the pressure of the spine, and it makes our job easier. And then we're going to start our treatment. So we're going to pull out the cervical protocol, which is first-time treatment or first-time patient. You're going to hit C2. Hit the start button to select that protocol. Now, as far as force, we always talk about first do no harm. We want to start with 10% body weight and move to 15% only if necessary. And that means if a patient is reporting no results in 3 or 4 treatments, then we might bump up the force. But the cervical traction studies are pretty spot on with saying at 10% body weight will get the job done without any doctor-induced irritation or traction hangover. We like to use a luggage scale. We like to take out the slack on the cervical unit, just like we do for the lumbar. We can put this right on the edge here of the hook. You can interact with the patient and see what exactly amount of force is comfortable or tolerable for them. So you can pull this here. As you can see, we're up to 10, 15 pounds. Is that good right there? That's good. And then you can set your maximum force at that 15 pounds, or you can go with that 10% number of the patient's total body weight. That should be the setup. If you have any questions, you can feel free to email or call us. Thanks. Have a great day.